It's good to talk with you here again.
Robbie, when I first moved here, I had the opportunity to visit you, I think within the first month. That was almost 8 years ago. And it's a pleasure to be interviewed by you again today. So thanks.
And thanks for joining us here after the El Pasoan of the Year event. And congratulations on being the 2021 El Pasoan of the Year.
Thank you.
So I'd really like to talk a good deal about the impact of Texas Tech in this region. And I understand it even extends all over the world at this point. And I'd like to talk more about sort of what's next. But first, in your remarks today, you mentioned your wife, Babette, several times. Yes. And on a personal note, you've got a very busy career. You're a doctor. You're the founding president of a health sciences center. How do you balance sort of life and work?
Well, that's a great question. Now, if you ask Babette, she may not say I balance it as well as she'd like.
Or how do you attempt to?
Yeah. The first thing I did was make sure that I had the privilege of choosing the most outstanding mate. I tell people I married the most wonderful, nicest person I've ever met, and I mean that sincerely.
Yeah, I think you said that was 41 years ago.
Yeah, and still, she's still the same. The nice thing is she is a good partner in allowing me to work hard and do what we need to do, but also at the same time pull me back a little bit and say, okay, you need to spend more time with the family, or we need to converse more, and also encourage. You know, sometimes jobs are just difficult. I'm sure you experience the same thing. You need to have somebody that you can talk to honestly and will provide honest advice. She's also one of my best critics. After I've spoken, she'll say, you know what, you said this too often, and you need to get over that. You know, all of those things together. But the most important thing is she understands why we're here and the mission and our dedication. So it's more a passion than a job.
And I think it was Rick Francis in introducing you that said that you like to bike. And was it biking in France, or?
We do.
Because you got to do something to let off the steam. I mean, I've got my little garden that I sort of putter around, but it seems like you got to have something to be different from your work world.
Absolutely. As you said, I'm older, and I still have to stay in shape, and at the same time, either burn off some steam or just use some energy. And biking is a way I can do that.
So I wanted to go back to 2014. Mm-hmm. I know you've kind of briefly told this story, but I understand you kind of got a call from the chancellor of Texas Tech, and they're like, hey, do you have any interest of being the president of this new 4-year university out here in El Paso? And oh, by the way, we'd like to know in about a week whether you're interested. So I was wondering, had you heard of El Paso, and what did you do at that point?
So not only had I not heard about El Paso, I didn't even apply for the job, Robbie. I didn't even know it was available, and somebody turned my name into a search firm. So when they offered me the job, and I had interviewed in Lubbock and Dallas, and I'd never even been to El Paso, my first response was, there's got to be something really wrong with El Paso. I mean, why else would they offer you a job to run a medical center and not come? So they asked for a week, and I said, give me 2 weeks. And I told my wife, and she was incredulous. She said, they offered you the what? And I said, we need to go to El Paso and find out what's wrong. So all this is hush-hush, it's very secret. The search committee hadn't revealed who the sole candidate was. And so we flew here, Southwest Airlines, stayed at the DoubleTree. We were in shorts and T-shirts, had a backpack with us. Nobody knew who we were, and we said, we've got to find out what's wrong. And we wandered around downtown. This is before it's even had the Renaissance. And we stopped everybody we could visit with.
Yeah, this hotel hadn't even been renovated.
No, none of this was down here at the time. And then we first went over to the medical center. It was the weekend. It was completely locked up. We couldn't get into a building. So I couldn't see any of the medical center. And I looked around and I saw it was surrounded by a bunch of abandoned buildings. And I said, why would you put a medical center in a place where there's a bunch of abandoned buildings? And I thought, you know what? That land will be available for expansion. And then we stopped people on the street. We went to Tom's Cafe, was open at the time. We had lunch there. We took a cab out to the east side of the city, had them drop us off, and then took a cab back just so we could visit with these individuals and find out what they thought about El Paso. went to Albertsons, walked the street, and
there's nothing like the produce aisle to get to know a community. I don't know what it is with grocery stores, but you run into people, you talk to people.
I find that conversations are shorter on frozen foods, Robbie, myself. But people love the community, and we could see ourselves here.
So, fast forward, I think we're 7-8 years later. How would you define the region's healthcare challenges?
Yeah. I think Texas, when you look at other states around the union and ask how many healthcare providers they have, we rank in the bottom 9 or 5 states just across the United States. And then we look at El Paso compared to the other major metropolitan areas, there's an additional shortage as well of every healthcare profession. That was one issue. The other issue was that the other health science centers weren't taking our El Paso students and training them, and if they did train, they weren't coming back. And many of the El Paso students here weren't exposed to healthcare professionals. I'm a first generation college student, and having somebody guide you through the process.
Yeah, and that's very true of many here in El Paso.
True, and their families many times don't want them to take off. So the opportunity to have a health science center here where you begin at the elementary school level to introduce them to healthcare professions, you reinforce it at the middle school. We have the senior students, the senior high students on our campus. We have UTEP pre-medical and pre-nursing societies to get them all ready, and then to know you don't have to go. You can study here in El Paso and get a world-class education.
When you talk about sort of the medical professional shortage here in El Paso, I mean, it's sort of a bit abstract. But I think, you know, anybody who's sat in a waiting room for a long time, or I remember early on here in El Paso, we had to get an appointment with a specialist, a pediatric specialist for one of our children. And they handed me the paper with like the date of when our appointment was, and it was 3 months from that day. So, I mean, it can be kind of abstract, but it really impacts, I think, many people here in terms of having that shortage of medical professionals.
It does. And so not only waiting for a long period of time, but there are many specialties that weren't here before the medical school came here. Pediatric subspecialties, surgical subspecialties, internal medicine subspecialties.
So beyond the shortage, what other challenges have you sort of defined here in El Paso in the healthcare arena?
Before I arrived, there wasn't a lot of collaboration with hospitals within the area, and certainly not within the hospital and the medical school, nursing school, and graduate school as well. And that prevented us from increasing the quality of healthcare and prevented us from turning out the individuals that we needed. That's all changed over the last decade. But that was a serious problem. And fortunately, Robbie, it helped us through the toughest times. It helped us through the mass tragedy, and it really helped us during COVID, working together to meet those needs.
So those are the challenges. Today, what would you say is Texas Tech's impact on the region and beyond in terms of addressing those challenges? I mean, it's sort of been a stubborn issue here in El Paso for a very long time. So what has happened to move the needle?
Yeah. I'll give you some statistics, and I don't want to bore you with these, except to say that the nurses we train, 90% of them stay in El Paso. So we've cut the nursing shortage from 20% to about 8%. 20%.
You're talking about like based on the national kind of...
That's based upon Texas. I mean,
okay,
it's worse than national. That's right.
Okay.
Yeah. We've increased the number of physicians across the area here in El Paso 57% over the last 8 years. 75% shortage of dentists in the area. 50% of people in El Paso have never seen a dentist. We now have a dental school.
How many did you say?
50% of people in El Paso have never seen a dentist. And now we've opened the first dental school in Texas in the last 50 years. With regard to the economy, the Health Science Center, the economic impact is $634 million a year now. Our annual budget is $332 million. That's money directly into our economy, into our region. It helps advance it as well. 25% of our students in the medical school are from El Paso. About 87% of our nursing students from El Paso. 40% of our dental students are from El Paso and the surrounding areas as well. So I'm very proud of what the medical school, dental school, nursing school, and graduate school have done in our area.
What about in terms of, you mentioned the cooperation, and when you got here, it wasn't a great relationship with Texas Tech or UMC, or just in general, there wasn't a lot of cooperation. How did you go about, and the other players here, go about knitting things back together?
Well, since I've come here, we have 3 new hospital CEOs. Jacob Centrone at UMC, Cindy Stout at El Paso Children's Hospital, and Nico Tejeda at Tenet. And we all decided is that none of us are going to meet the healthcare needs alone, and we have to cooperate. I don't own a hospital. I have to have training sites. They need outstanding nurses and physicians. They can't train them. I do that.
Right. When you say training sites, you mean like for residencies or internships or that sort of thing?
Absolutely. The students have to have a place to take care of patients. The residents do. The nurses do as well. And our dentists as well will be seeing patients as students. And so that's absolutely essential. If they have a great experience here and they love El Paso, like my wife and I do, then they're more likely to stay here. Or if they go do additional training, then come back here.
Well, many young people I meet, it seems like they want to be here more than ever. It's just sometimes hard to find those job opportunities. So, like you said, there's an economic component as well at creating opportunities for high-wage jobs, that sort of thing. And you mentioned the dental school, and I understand there's some unique aspects to the curriculum where the students actually get to start working with patients very quickly. When was the first class? When did they start?
So the first class started last year. They're
Okay,
just finishing up their first year.
Have they seen any patients yet?
Well, you're talking to one of them, as a matter of fact, Robbie. So I was among the first patients. I had chipped a tooth. I went to the dental dean. I said, when do the students learn how to fix chipped teeth? And he goes, well, they learned that last week. And I said, are they ready to take care of patients? He said, absolutely. So I was one of the first patients they had seen. My wife, this is HIPAA violation, seen by the dental students last week, Robbie.
I think you have your wife's permission.
So what we're doing is we're teaching them basic skills, and they master those. They take them in the clinic. And then we bring them back and teach them more complex skills. And then they take those to the clinic.
That's faster than I'd ever imagine. I mean, to be repairing a chipped tooth, and that's pretty brave on your part to do that.
Well, so I was so convinced of the training they had received, and it's interesting, the attending was sweating and nervous. The students, cool as a cucumber, absolutely perfect. It could not have been a better experience.
Who drew the short straw to do the work on the founding president of Texas Tech University Health Sciences Center?
Well, it's interesting that you mentioned that, Robbie. The students, and they don't take pictures of us, but they have colleagues training around the country, and they're taking pictures of what they're doing. And their friends are saying, I'm sorry, we don't get to do that to the third year. Yeah. And we're teaching them to do it very early on.
So what's next? There's always seems to be some exciting thing on the horizon. Just opened the dental school. Big $10 million donation for the endowment of the biomedical school and all that. What is next on the horizon?
The biomedical sciences, we have a master's program. We're going to grow that into a PhD program. We're going to be offering additional nursing training. We're doing subspecialty training in the various medical fields.
When you say additional nurses training, do you mean like nurse practitioners, that sort of thing?
That's right, and specialties,
I understand they've become increasingly important in the medical landscape.
We don't have enough doctors, and the nurse practitioners and physician assistants can help be physician extenders. You're absolutely right. We're increasing the number of training programs. At Trans Mountain, we've added internal medicine, family medicine, OBGYN, and pediatrics. At UMC, we're adding a pathology residency. Never before in the area have we had one. We're bringing anesthesia back so we can train anesthesiologists and get them to stay here as well. We'll do a pulmonary fellowship so we can train our lung doctors to be here in the area. So those are some of the things. And then we need to look at what other allied health fields needs there are here in the area and address those as well.
Are there needs for future campus expansion or anything on the horizon that way? I know you just completed a building.
And that building temporarily houses the Dental Learning Center, but we need a facility that actually will house the entire dental school, the Learning Center, the dental clinic, and allow us to grow. We'll go from 40 to a total of 240 students over the next several years. We probably need to get to about 400 students to meet the needs of this area.
So I wanted to get your general advice for young El Pasoans, or really anybody who's interested in getting into more of a leadership position, and what you might have to say about being a leader, whether it's in your organization or in a community. What's sort of some of the key features to succeed as a leader?
Right. First of all, I'd say servant leadership is incredibly important. I think you approach leadership by serving other individuals. It's not to bring notoriety to oneself or to actually continue to advance the ladders, to actually serve. I recommend identifying good leaders and getting mentored by them. I've had great examples throughout my career of individuals that have had great leadership skills, and I've tried to pattern myself out. And some that didn't, by the way. I've tried to avoid those. And I think that's incredibly important. And then you have to be able to be honest about what you're not good at or what you don't enjoy, and surround yourself by people that can do those things.
Yeah, that self-evaluation can be easier said than done, because we don't see our own blind spots that way.
Bingo. You're absolutely right. And so we do a self-evaluation, and then we need other people to be critical, constructive, but critical as well. We'll never grow. I'm happy to say that Bobette's an important part of that. She provides constructive criticism. She is right on about what things I need to work on. But to have that kind of a relationship where somebody can help you grow into the leader you need to be. There are things that I don't enjoy or don't do as well as other things. I surround myself by leaders that do those things. And I value everybody. Everybody has a unique skill set, so identifying what that is and letting them excel. And I think we've done a really good job of that at the Medical Center.
You grew up in Alaska.
I grew up all over the United States, but you're right, started in Alaska.
Okay, is there any similarity between Alaska and El Paso?
There is, as a matter of fact. Big, wide, open space. A can-do attitude, by the way. The Alaska community is actually very tight. You do have a little bit of this, I want to be by myself, independent.
Right.
But you have to survive, you have to do it as a community in Alaska. And I'd say the same thing happens in El Paso.
Yeah, sort of our centrally isolated position here. We have to look out for each other here.
Absolutely. I mean, it's right. Ohio's not coming to rescue Alaska. If Alaska doesn't get it done itself, it just doesn't get done. And then, you might not think it's true, but Alaska is a border community as well, just like El Paso is.
So that's all the questions I've got, but I'd like to leave it open. Is there anything you'd like to add here?
No, it's been a wonderful ride. It's not over yet. But if you ask me what I thought the medical school would be doing, I could have envisioned doing it, but it was 15 or 20 years down the road, not 8 years down the road. And it's a testament of the commitment of the community to see the value of it. Commitment from the Texas Tech system to pour into this. And Robbie, what we're doing here is affecting not only West Texas, but as you said, the world.
How important has been the contribution or the support of the business community in El Paso and the community leaders? I'm thinking of some of the big contributions to back some of these projects. How key has that been in your success and the success of the University Sciences Center?
You might say, somebody gave you money and that's the success. No, that's not what mattered. What mattered is when we went to Austin and said, we need money to provide a building, or we needed money for our medical school. They said, well, what makes you think that we should give you the money? And we would go back and say, we just raised $50 million from Paul Foster, or $25 million from Woody Hunt, or $10 million from Rick Francis. And that got our foot into the door and made everybody in Austin realize this is the real deal. The community is totally behind it. We could not have done that without those big gifts. Paso Del Norte Foundation as well, I should say, by the way. That opened the door and told Austin, as you said, you're in a remote area, you got to take care of yourself. I said, we're going to take care of ourselves. We want Austin to be a part of that as well.
Well, thank you so much for your time again.
Robbie, it's always a pleasure. I really appreciate your interest, and I appreciate what you bring to our community. Thanks.
Thank you.